So you have found a breast lump. Now what? The way to find out what we are dealing with is with a biopsy or a needle test. But wait, does that mean I have cancer? Let me tell you right off the bat that just because you have a biopsy does not mean that you have cancer. The thing is, there are so many other causes of breast lumps, and I will leave a link of a video where I have talked about those things in more detail. You can check it down below. So what is a biopsy? Well, a biopsy is a test where we take a sample of tissue and send it to the lab for analysis. We want to know what we are dealing with. The only way to find this out is by seeing what kind of cells we are dealing with. And then secondly, we want to know whether they are normal or abnormal. It is done under local anesthetic and it literally takes less than 5 minutes. Firstly, we will numb the area using local anesthetic. Then we take a biopsy or a needle test where a small sample of the area is taken. It is not unusual to take a few small samples at any one time, and this is to make sure that we get a good representation of the area. Once that's done, we would normally apply a small plaster, and that's it. If the lump can be seen with an ultrasound scan, the biopsy can be done in the same room. However, if the lump or the lesion can only be seen with a mammogram, then the biopsy will need to be done with the help of the mammogram machine. So what are the common side effects of a biopsy? Number 1, a little bit of soreness, and this is not unusual. Remember we used a little bit of local anesthetic when we took the sample? Well, the effects of the local anesthetic will eventually wear off, and so in anticipation of that, do take some painkillers, and this should cover any discomfort you may have. Number 2 is bruising. And again, this is quite normal. This can happen when the needle catches a blood vessel when it is taking the sample. Bruising should settle down with time. Very rarely do people get what is called a hematoma, which is a large collection of blood underneath the skin. And again, this usually settles. Number 3, sharp shooting pains. This happens when nerves are affected at the time of biopsy. What can happen is a few days after the biopsy, suddenly you'll notice sharp shooting pains or even stabbing type of pains around the biopsy site. This is again very normal and should get better. So what happens to the sample that we've taken? The sample is sent to the lab and analysed by the pathology team, and the process may take anything between 5 to 7 days. And that's because they have to prepare the samples that we have taken so that they can look at it underneath a microscope, and it's a pretty lengthy process. They have to fix it with a special fluid to preserve the tissue. Then they'll have to embed it in paraffin to allow slides to be made from them. They will then have to use special stains that will make the special cells be more visible. And there is a long and complicated process that the pathologists do to make sure that the samples that we take can be looked at in the best possible way. From what they can see, the pathologist then will be able to compile a report that tells us what the nature of the lump actually is, whether it's a cancer or whether it's something that we don't need to worry about. So what happens if it is a cancer? Well, a treatment plan can then be formulated based on the type of cancer it is. And breast cancer treatment can involve many modalities such as surgery, chemotherapy, radiotherapy, and tablet treatment. If you want to learn more about how breast cancer is treated, then I will leave a video where I explained all of this in more detail. In the meantime, take care and I'll see you in the next video.